on June 18th. We roll call.
Commissioner Hankins,
Present.
Commissioner Lambright, Commissioner Mason,
Here.
Commissioner Aaron.
Here, online.
Okay, would we like to add or remove anything to the agenda? Okay, then we will go on to approval of the meeting minutes from March 15th of 2024. Would somebody like to make a motion?
I'll make a motion.
I'll second. Mason motion, Van second. All in favor, say aye.
Aye.
Aye. Anybody opposed, say nay. Motion carries. Public comment. Anybody like to say anything for public comment?
My name is Tracy Skinner, and I'm here to read public comment from a couple of my coworkers. These are not my comments. This is from Cheryl Green, public health technician. She's been with the health department for 26 years and been maxed out on pay scale within her role for close to 20 years. There are others in the same situation as I am, so we count on the cost of living as our only chance for a wage increase. I hear in a lot of meetings how important it is to try and retain staff in the upper levels. Anytime you lose staff in any of the pay levels, there's a price to pay. There's always cost of hiring and training new staff, no matter what pay level they are. It should be just as important to retain staff at the lower pay levels as it is the higher ones. One way to ensure this is to make sure that we all receive a decent COLA, as we cannot ask for a COLA that is more in line with the increased cost of living. The additional days between observed Christmas and observed New Year's holidays would help offset this, along with boosting morale and retention. The next comment I have is from Scott Johnson from the Environmental Health Division in Otsego County. To the board, thank you for listening to my comments and observations concerning the compensation committee's recommendations. I have worked for 3 health departments over 36 years, 24 of which are with this agency. All have been small, personal, and good to work for, and all have the common hardship of retaining and recruiting employees. I know this committee has worked hard to run comparisons with other entities in the state to remain competitive, and we have been. However, we are losing seasoned employees. We have lost nursing staff to regional hospitals and doctor's offices. Recently, we lost 2 environmental health staff, the state of Michigan's Environment, Great Lakes, and Energy. It took 2 months to fill the environmental health position lost to Eagle, really disrupting the type 2 program, in which we have the 4th largest number of type 2 wells in the state to monitor at almost 500. I would like to see the proposed package presented tonight approved so we can continue to retain our seasoned staff and recruit new experienced staff. We are on the cusp of remaining competitive. Qualified hires are hard to find, expensive to recruit, and time intensive to train. I think this proposed package is a good fit for retention and recruiting of employees for the whole nation. Thank you for your time and consideration. Scott Johnson.
Thank you. Anybody else? Okay. We'll move on. Employee compensation presentation.
Well, we have a few employees that are going to be doing presentation, but the letter that you have that kind of outlines everything. Caitlin Nellis here is going to go through that really quick and then hand it off to Dan Howard for the presentation. Correct? Okay.
All right, good evening. My name is Caitlin Nellis, and I'm a supervisor in our family health division. With me this evening are 5 other staff representatives. I will let them introduce themselves to you now.
I'm Bethany Lieberman, and I'm a family health division.
Tracy Skinner, family health.
Victoria, community health.
And Howard, family health.
And Melissa Purdy, administration. We are a subcommittee of the employee committee who have been focusing on working with our leadership team to create the compensation package we are here to discuss tonight. But before we do that, I would like to explain what the employee committee is and how it is comprised. The health department in Northwest Michigan is not unionized. Instead, it has an employee committee that is made up of 2 elected representatives from each employee group. We are responsible for supporting open communication between our respective divisions and administration. We serve as liaisons in the areas of compensation and policies that impact employees. As representatives, we are considered the voice of the division we represent. Over the last 4 months, our subcommittee has worked closely with leadership to create a compensation package that meets the needs of the employees while balancing fiscal responsibility to our agency. Please know that what we are presenting this evening has been thoroughly discussed and approved by our leadership, including our CFAO. The goal for this evening is to review and recommend the proposal to the full board for their approval. We look forward to your support of our proposal as we prepare to present it to the Board of Health on July 2nd. As I turn this over to Danica, we ask that you please hold your questions until after the presentation.
Thank you, Caitlin. With that one. Okay.
Support and collaboration from our leadership team, our compensation proposal for fiscal year 2025 is the following. A cost of living adjustment of 3% for 2025 and the permanent addition of an office closure with pay for the 3 work week days between Christmas observed and New Year's Eve observed. Our current policy excludes any staff less than an 8.8 FTE from receiving any paid time off, including PTO and holidays. This proposal is inclusive to all staff, including part-time colleagues. Staff feedback is extremely important to our committee, and we know that it is important to you too. We would like to take this opportunity to share with you what our colleagues are saying about this proposal. Implementing a 3% COLA helps counteract inflation and ensure that our compensation keeps up with the rising cost of living. Additionally, this adjustment can enhance employee satisfaction and overall well-being by offering more financial stability. Compensation is one of the most important measures of how employees are valued by an organization. I feel like this package moves in an encouraging direction to help me feel valued as an employee. I have been stuck at my current spot on the pay grid for many years, and a COLA is my only opportunity to see any wage increase. At this stage in my life, I do not want to have to find another job, but I also need to be able to afford to continue working here. A cost of living adjustment is not a raise, but rather a wage adjustment to combat inflation. Anything less is considered an economic loss to the employee. We did not request for an additional adjustment in response to the inflation rates of 2022 or 2023, unlike many other county entities. Understandably so, our 3% COLA over the past 2 fiscal years has not kept pace with inflation. Our team has analyzed the cost of a 3%, 3.5%, and 4% COLA after reviewing the needs of our colleagues while also keeping in mind the reality of working in the public sector. We determined that a modest 3% COLA would balance both of these needs. The projected cost of this increase is $428,903, and would be distributed amongst 169 staff members. We appreciate the commissioner-led initiatives that were taken on behalf of local public county entities to address unprecedented inflation over the last 2 years. Of note, the Antrim County Commissioners approved increasing the contractual 2.8% wage increase to 4% for the general bargaining unit in 2022. In 2022, the Charlevoix County Commissioners approved county employees receiving a 5% increase in addition to the already approved 2% increase. I won't read this for you, but feel free to take a look at it. A lot of information. Looking ahead, we appreciate Antrim, Otsego, and Emmett County Commissioners for already recognizing the importance of responding to inflation with appropriate COLAs for their employees and anticipate similar action later this year in Charlevoix County. We look forward to receiving the same support from each of you. Working in the healthcare field requires specific educational requirements and skill sets. Our counties have a limited number of people who meet this criteria. While recognizing the constraints of remaining competitive with for-profit agencies, our team firmly believes that we should keep pace with facilities overseen by our counties. The following 2 slides show how Bay Bluffs and Grandview have adjusted their compensation packages to address the national healthcare shortage. You may have noticed the financial incentives offered to employees of these county facilities. While our agency cannot compete with that, we can offer a creative solution by closing our offices with pay for the 3 days between Christmas observed and New Year's Eve observed. As our letter referenced, employee turnover remains a top concern. The table in front of you reflects open vacancies in our agency since November of 2023. Of note, our school health division has 3 unfilled public health nurse and 3 mental health professional positions open. Our mental health professional positions take on average 6 to 7 months to fill. I would like to share this quote with you from an employee in our newly formed school health division. This proposed compensation package is vital for employee retention and employee satisfaction. In the child and adolescent health program within the past year, we lost 4 potential candidates for mental health professionals due to our salary offer being too low to meet their needs. It takes a considerable amount of time and effort to recruit good candidates and then to train them to be efficient in their jobs. If we could be more competitive in not only our wages, but in non-monetary benefits, such as time off, it would help with our ability to secure qualified candidates and then be able to keep them. This will create consistency in our program, and this consistency with staff will in turn have a bigger impact, such as improved relationships with our schools and community partners. Dan Burrell shared concerns to address employee turnover at the June 4th Board of Health meeting. Our medical director, Dr. Meyerson, is now the only member of the leadership team that has been in this position for more than 4 years. These positions require advanced education and experience, making them difficult to fill. Of the 169 employees at HDNW, only 37 have been with the agency for more than 10 years. Please keep in mind the financial impact of turnover for our agency as it pulls staff out of their regular roles to train new staff. Staff attrition not only impacts the employees that remain at the agency, but our communities as a whole. I would like to point out a poignant example of the true cost of employee turnover. Last summer, the entire Otsego County Family Health nursing staff turned over with the exception of 1 nurse. This resulted in a significant loss of services for families with young children in Otsego County for several months, as shown on the provided table. The stark contrast between July 2022 and July 2023 visits for Otsego County speaks volumes, as the number of maternal infant health program visits dropped from 97 to 26. Our communities deserve consistent services via an adequately staffed health department. We recognize the 4 counties offer variations of holiday schedules for their employees and applaud the leadership shown by our county commissioners for recognizing the unique needs of each county, as well as each county entity. As a committee, we have spent a considerable amount of time reviewing holiday options for this proposal. In lieu of asking for the addition of paid holidays for Veterans Day, Martin Luther King Day, and a full day on Good Friday, we propose an office closure with pay for the 3 days between Christmas observed and New Year's Eve observed. With the endorsement of our health officer and CFAO, we strongly feel that the selection of these days maximizes the impact on staff morale, recruitment, and retention while minimizing any impact on operations. In addition to the agencies listed on this slide, there are several health departments that are working towards implementing this model. Our leadership team is in full support of this positive change. We appreciate you looking at this through a creative lens while recognizing that many county agencies are moving in this direction. It is also an opportunity for you to not only support our proposal, but to bring this innovative retention concept back to your individual counties. Later in this presentation, you will hear from our colleagues who have voiced tremendous support for this proposal. The proposed 3-day closure would have minimal impact on operations. We are always available to meet our community's needs. It is our agency's practice to provide after-hours on-call coverage, and the executive team rotates that responsibility each month. Community calls are routed directly to the on-call employee's cell phone when the office is closed, including evenings, weekends, and holidays. The on-call employee knows who to call for immediate assistance. Some recent examples include responding to a bat encounter, tuberculosis case, and a dental emergency. These calls have resulted in the community members being connected to the resources they need within 20 minutes. We also have staff who are expected to respond in an emergency, including nurses and public health techs in communicable diseases and immunizations programs. For example, regardless of the time of day, staff must respond to a sensor if a sensor indicates a concern with temperature of stored vaccines. Of special note for our family health director, there are a significant number of no-shows in clinics this time of year. And taking this into consideration, clinics can easily be scheduled the days immediately before and after the proposed closure to meet community needs. There is a minimal impact on environmental health services as indicated on this slide. Many community health staff are based in schools, which are also closed this week. Our committee is passionate about this addition to HDNW's compensation package, as we believe this unique concept will not only boost staff morale, but will also make a significant impact on our staff retention crisis. We thank you for taking the time to listen to our presentation on behalf of our coworkers, but we believe their own words truly say it best. Having the time off between Christmas and New Year's would be so beneficial to my family. As a mom of 2, I want to spend as much time as I can with my family. My children's daycare closes for over a week for Christmas break, so I typically have to find alternative childcare for them or take PTO. Furthermore, it is not a guarantee that I can even take PTO around Christmas and the New Year because the nurses have to take turns having this time off to ensure there is always someone in the office during this time. Having time off agency-wide will both guarantee that I have time with my family and lessen the burden of finding alternative childcare. Having the 3 days off between the holidays would be a fantastic perk that other nursing jobs don't offer. This would make me want to stay at HDNW. Not all of our staff are able to use PTO for true time off to recharge, but rather some need to use all of their allotted time for medical appointments and to take care of loved ones. This time off would ensure that everyone has an opportunity to take some time off guaranteed. Providing time off between Christmas and New Year would allow us time to unwind and detach from work responsibilities, recharge mental and physical energy, enabling us to return to work feeling refreshed, focused, and motivated. Having a work-life balance is important to the quality of our employees' lives. Having time between the holidays gives us an opportunity to spend time with family members that live far away, allowing us extra time to travel. Having those days off between Christmas and New Year's would be so helpful to spend quality time with family and not have to stress about trying to find childcare over the holiday when daycares and schools are closed. The fact of the matter is that HDNW has not been able to keep up with the cost of living adjustments over the last few years. Staff have continued to perform at high levels despite not being compensated appropriately. Having the time off between Christmas and New Year's helps me to feel valued that our agency is listening to employee input. In closing, we propose a cost of living adjustment of 3% and an office closure with pay between Christmas observed and New Year's Eve observed. This office closure with paid time off between Christmas observed and New Year's Eve observed will be a permanent adjustment to employee compensation. On behalf of our committee and the 169 coworkers we represent, we thank you for your support.
Are you finished?
I'm not. Thank you.
Does anybody else need to speak?
I don't think anybody else is planning to speak.
Okay, so do we have any comments? Would anybody like to ask questions or say anything? I would. I think it's a great idea. I do. I work in a public place, and that's usually the time where everybody's busy making cookies and doing things, and I think it's really creative. I do, because it would help in scheduling. People don't have to worry of people not showing up at the last minute, and what are you gonna do, because it happens all the time. And who do you get when there's nobody available? It's really hard, and I think all your comments were right on. I do. I think 3% is very reasonable. I don't have a problem with any of it. What I have a problem with is I think it should only be yearly. I think that we should not limit for the people in the future, but I think it's a great idea. I don't know if you want to say something, Scott. Neil, do you have anything to say?
I think it's all entirely reasonable from what I've seen too. I know it can be difficult for families in between the holidays and working and such, the schedule with kids and such around. And I think 3% is very reasonable, considering everyone has been struggling with the inflation rate. And we need to figure out at many different levels over society how we can cope with this. And I'm glad that they've come up with a way at least to help mitigate some of that with this cost of living adjustment.
I do have a couple of questions, and I think either Dan or Shannon can respond to them. We currently offer retirement benefits to employees. What are those benefits?
The retirement benefits, so looking at the exact,
Is it MERS?
it's MERS, it's defined contribution.
Okay.
So a long time ago, I think we had 2 staff members that are still defined benefit. And just 2. Yeah, so I think like in the mid or late 90s, they shifted away from defined benefit with the defined contribution.
Okay.
And that's
Is there a multiplier?
so it is, the agency contributes, I think it's 9%, and the employee contributes 2%.
It's 7%.
7 and 2, I'm sorry, 7 and 2.
7 and 2.
Employee will contribute 2% to help match that.
That's what it is. Yeah, so it ends up being 11%.
Okay.
Yeah.
11% contribution, and then is there a specific retirement rider, like as far as age or what the multiplier is for years of service?
No, it's just, basically with the 401A, it's at 59.5 years is when you can start drawing from that.
Okay.
Right, so I think the only other thing is, if you laughed at this, yeah, I caught that. The only other thing is like, so the health insurance, like in a retiree after so many years, and forgive me, I can't remember the exact, it's 25 years. Yeah, you can, an employee can, after they retire, like participate in the agency's plan. They have to pay for it on their own, but they get the group rate. Okay,
Okay, do employees contribute to their health insurance
yeah,
while they're working?
yes.
What's that breakdown?
Oh, boy.
Well, so we're comparing, if we're gonna compare apples to apples. There's some comparisons in here about shift differentials, things like that. I don't believe that, that our staff works on different shifts. Is that correct?
That is correct.
Okay, so that to me isn't comparing apples to apples.
Well, you know, with all due respect, I think the comparison was like who our competitors are, right? Especially for like medical staff. And so that's something that like a nurse working for the hospital would get, for instance, compared to what we have.
Okay.
That I think is the comparison, correct? Yeah. Yeah, so so we have two types of in the medical side. We do, yeah, okay, I'll let you.
Yes, and we have the two different types of health insurance. You can get the PPO plan or a high deductible health plan, and it looks like, if I'm reading Shannon's spreadsheet correctly, which is intricate, that per pay period for a full-time employee, so a 1.0, is $35.58 per pay. Single, and then for a family is 77.08. And most of our employees are on the high deductible health plan, which is $28.62 per pay period and $62.01 for a family.
Is there an HSA that's attached to that as well?
Yes.
How much is the contribution from the health department for the HSA?
So last year it was 3,000. Oh, 3,000, but we need.
It's less.
Is that on that spreadsheet? Looking for the top, maybe. Don't see it.
I believe we contribute around 2,000. That's what I was thinking about there. That sounds right. Okay.
Again, if we're comparing apples to apples, when you talk about a nurse who works for McLaren and Petoskey, their shift preferential is because they're going to be working weekends or nights, or whatever.
Oh yeah, yeah.
The same with the sheriff's comparisons that you're making here. Those folks don't get Christmas Eve to New Year's Eve off. They have to work. So I think some of these comparables are not, again, they're not apples to apples. I'm not saying I'm opposed to this, and I'm certainly not opposed to the 3%. I guess I'd like to know how it will affect the operation of the department if we close that week.
Sure. Well, I mean, basically the reality is that it's a pretty skeleton crew that week anyways. We do have clinics going that week. Lots of times we have no shows that we're dealing with. So we wouldn't be, I guess we wouldn't have told the committee, I guess, that this is something that we should move forward with. We would think like, well, you know, I mean, there's some merit here. I mean, it might be the low-hanging fruit because there's just not much going on here at the health department. And the amount of no-shows that we receive in these clinics is pretty significant. There's some other health departments that do this in the state. Those written down, I think they were in here. Huron, Sanilac, Muscola, Central Michigan, District Health Department, Michigan, to name a few. I know some others because they're grappling with kind of the same thing, staff retention and whatnot. I put this out there to find out how many were doing this to the other health officers throughout the state. And they're all, you know, a lot of them that they let me know who wasn't, but it was. Like, that was something that they were looking at as a possibility because of some of these issues, so. I think the key here is, obviously we're a public agency, so any difference in services, we have to just be, if this was approved, we'd have to be very good about communication to the public and just make sure that it's put out there often, leading up to that week, so that everybody is aware. Because, last thing we want is somebody to show up thinking that, we're hoping, and we're not. So, I think that's the key.
If I remember right, there are roughly 46 health departments throughout the state.
That's pretty good, Scott.
Yeah.
Yeah, it's 45, but I'll give you credit.
Is that with the city of
That's
Detroit though?
Phil.
Yeah, that is with the city of Detroit. That's pretty good.
Okay.
Yeah.
So, 5 of the other health departments out of those 45 have adopted this model, is that correct?
Yeah, 5 or 6.
Okay.
Yeah, but maybe they have something else.
Actually, yeah,
Maybe they have something else that they negotiated instead of this.
But it's not like apples to apples to your point, so some of them do recognize the other federal holidays that we don't recognize. And even some of these aren't like our district health department, some health departments are Central County Health Department, and then the county health department, so it's. You got all those nuances in here. This was just an example. Yeah.
Shannon, I don't think we got a response from all 45 health
No.
departments.
No.
This is just
no, that's true.
that the response we got, so this isn't on all of this list.
Okay.
Do you have anything else?
And the HSA contribution is $2,900.
I'm sorry.
Okay.
The HSA contribution from Northwest,
How much?
$2,900.
29.
I don't have any other questions, guys.
Okay. I do have a question, but I wanna switch this, I'll make a motion. If we have to make a motion. Make a motion to send it up to the board, I make a motion that we do, and I make it though for a year. 1 year, and we do this again next year. My motion. If somebody wants to second.
Are you talking like the 3% was a 1 year? Are you talking for the office?
Yeah,
Too?
The closure for 1 year, and then we'll look at it next year. Yeah, go. I don't want, yeah,
Can we? Well, I'll second your motion to lead to further discussion. How's that?
okay, let's do that.
I'll second
So
your
you're seconding
motion.
my motion,
Okay.
the discussion.
I would like to see the proposals as two
Separate.
separate. The pay raise, I think everybody's on board with. I don't know that I'm on board with the 3-day clock.
Okay, what do you want? What kind of information do you need to see for the full board?
Well,
What do you want to know? What do you want to see so that everybody else knows? That would be helpful.
I would like to see the full comparisons. For example, if we're losing employees that are going to work in a hospital, I'd like to see what those compensation packages are. Because I know one of the things that I've heard from nurses is that they get terrible health insurance working for a hospital. So I don't think that's the case here. And I think, to throw numbers out and say, well, so-and-so's making this, if we're only looking at that, we're not looking at the full package, the retirement that goes along with it. If a nurse goes into private practice right now, working under a doctor, do they get a MERS retirement? Do they get an HSA? Do they get all of those other things? Or do they make the money up front and have to fund those other things themselves? Everybody, listen, every employer has difficulty maintaining or retaining or recruiting staff. Everybody has difficulty with that. I understand. Those are the things that I would like to see.
Can you do that for the next board meeting?
We have the compensation committee that put these statistics together.
I mean, there might be limited on finding out information from like doctor's offices.
Sure.
But certainly probably from some of the hospitals and
Yeah.
would be easier. Okay.
You have anything else to say about this?
No, I agree that this, yeah.
Okay, so you said you wanted it like in separate motions here or at the board?
Let's divide it up.
I would divide it out.
And we can put that in the motion.
Right.
Yeah. Let's do that. With more information for Scott on the days off, with the other benefits that we have. Neil, are you okay with that?
Say again?
Are you okay with having two separate motions at the board meeting? For the 3% and the days off during the holiday?
Sounds reasonable. It doesn't really matter to me.
Okay, so, all in favor, say aye. Aye. Anyone opposed? Okay, motion carries. I do have a question. Under, I saw where they said that 37 other people have been here more than 10 years. Is there a limit of an increase for people that have been here a long term? Yeah.
And like step increases?
Yes.
Yes.
And have you looked into any of that? Like is there a way to do something after that? Have you checked into that?
We've actually, I mean, as a committee, talked about that, but,
What would happen?
well, it turns out that it's complicated, and then we have a number of staff also that are new, right? So like, how do you, I mean, as far as like being fair to everybody.
Right, but that's where you have your trained people.
Oh, yeah,
and you
absolutely.
use all that, and it doesn't necessarily have to be money. It could be an incentive of some other kind.
Yeah, I think that's something that we, definitely, what we landed on is that we needed to have more conversation and just kind of tease some of those things out and figure out what those look like. We just didn't, we kind of ran up against the time limit, here, so.
I think the committee's goal, if you're correct, if I'm wrong, was to try and keep it equitable across the board for every staff member, regardless of your number of years of service or the compensation level, everybody would get the same. And I think that their 3-day creative solution, if you will, it's not going to cost the agency significant amount of money, but it's something that we could do to kind of compensate for not getting more money. Well, then here we can give you these 3 days between the holidays to help with that, instead of being able to offer additional.
Yeah, I think it's
Right.
really tough, because the longer you're at a place, the more you know, the easier
Oh, yeah,
your job gets.
absolutely.
Use those people. And I understand the increased people, but like there's some other way.
Right. And that's kind of looking at the, the classification and compensation schedule as a whole.
Yeah.
Everything, longevity, all that stuff. That's a bigger task, I guess.
Have you ever looked at that before?
Well, I mean, it's been looked at, before, not we haven't. But it has been, I think, looked at and adjusted back in 2018.
So what do you mean by adjusted? Like, what did they do? Give more money? What?
Well, I think they just did like a wage study and readjusted, realigned the classifications and the jobs and the job descriptions and pay scale and all of that.
Can I add something? I think I'm concerned, and I'm not speaking for everybody, but I'm concerned about splitting the motion, because 2 years ago, we came, and I think Commissioner Hankins was the only person that was part of Board of Health at that time, we came to do an employee ask. And at that time, inflation was crazy. And because of the constraints that the health department was facing, we only asked for a 3% COLA then. And it was not at all in line with what the inflation actually was. We haven't gone back and reopened any discussions to ask for anything additional, even though many other groups have gone back in the last 2 years to ask for additional compensation because of that. And so part of our crafting of this message was in consideration that 2 years ago, we asked our employees to balance the budget on their backs. And they didn't, you know, if you're getting 3% and everything that you're spending to come to work and do is costing much more, your dollar's shrinking. So the ask that we're coming up with now, because again, we had several significant discussions about what we could do reasonably. And our health department is still looking we're very careful with the budget to look at where's this going to come from, what would it cost? And again, we're still not catching up with what inflation was 2 years ago. So we're going backwards. And so to ask the employees to split that motion and say, because we really looked at the 3% and the 3 days as a way to compensate the fact that we've been behind the game for 2 years already. So that's my piece. I feel like we've been asking the employees, like, you know, your electric bill goes up, we don't negotiate with them. Our employees and the health insurance, I'm a 0.8 employee. I pay a different ratio for my health insurance. We never know what's that going to be from year to year when you come back. So the numbers that you're getting quoted, I'll tell you as an employee, we don't know what that's going to be. We also don't know what's going to be available. I have a high deductible health insurance plan, and I'm very grateful for it because I needed it last year. But we don't know what the contribution is going to be to the HSA. That's never a guarantee because the health department has to look at the full range of what's available, what we can do. So I really am opposed to splitting the ask. That's me personally, because I feel like this was a package proposal because we were way behind that COLA.
And to add on to that, the budget that the health department has is for the entire year, and that having those paid days is not taking away or adding to our budget. It's already budgeted for the entire year. By adding a holiday, that's additional, you know, expense to the agency. So that was the other piece of that being kind of tied in and intertwined with the 3% COLA as well. I agree with Tracy. I don't want to split
You
it.
just want information. Don't you just want information?
Yes,
Information, I think
Right.
that's absolutely fair.
So we'll have two separate discussions. Doesn't mean we will deny the holiday time off. You're not the only one suffering these issues. You ought to see what's going on with road commissions. The money that the state is denying them, they're not keeping up with. So where is this all going to go in the end with everything involved with state, federal monies? They're taking a 7% loss with the 9% inflationary increase. And so they're already cutting huge corners, make up for those losses. So there's no easy answer to this. So, I mean, we've already agreed to separate the package. It doesn't mean you're going to lose that increase or not that increase, but that holiday time off.
I think it's just important to know that that's how we considered it.
I think when we get the presentation, you say so.
That it was considered as a totality. And the other thing is for some of our employees that are less than a 0.8, we don't get time off. And so I think to, I guess, be equitable to all of our staff and understanding that this is low hanging fruit as someone who's worked clinics in between Christmas and New Year's. If people come, it's kind of a really a crapshoot. You don't know if anybody's actually going to come. And so a lot of times we're sitting there paying staff to keep the clinic open, and they could have been home with their families. And there was nothing being accomplished. So
Well, okay. But to that point, the police aren't necessarily always responding to emergencies on those 3 days either. But in the event that there is a need, they're there.
But we still have that on-call process. And I would argue that the police responsibilities are far different potentially
But you use them in your presentation.
than what my social work duties might be.
Okay,
This was looking at county entities that have come back and asked for increases in wages. We're not trying to compete. I want the police to be there doing what they need to do.
and I want the health department to be available in the event that somebody does have an emergency.
And they would be just as they are every evening and weekend and holiday
Okay.
currently.
Yeah,
We're not
I
gonna
think
have
that,
to
I
do-
think the difference though too is that when they brought up the county or, and these are union or they're not,
Mhm.
and there's a huge difference.
So our presentation respectfully should have been health department to health department to health department.
Yes,
I would
In my
like
opinion.
that.
yes.
Next time.
Okay.
I think when, they will give their presentation to the full board, correct?
Yeah.
Yeah, when you give your presentation, say that, you know, and Scott still wants, you still want information.
I would like to see okay, so we have 5 health departments that are following this model. There are at least 40 others that are not. I guess to me, it makes more sense if we're comparing health departments rather than other agencies, other entities. I know I'm the jerk in the room right now. I got 20 pairs of eyes looking at me thinking, what a jerk, but that's my thought process.
Just like that, I don't just want to talk
Open Yelp.
about it. And two, like.
Help has been uploaded from this iPhone.
I'm sorry, Kate, I can't hear you. There was. Sorry.
Is like, there's a lot of us that do home visits. And so the amount we get for, and we use our own vehicles. So the amount that we get for mileage, especially when gas prices have skyrocketed, we're eating that. We're not getting covered for the wear and tear of our vehicles, the miles we're putting on, the tires we have to replace, the damage from the boats we go on. You know, and that's all federal government. So, I mean, I think it's good that we try to think of some other ways.
But that to me is a negotiation point.
We can't negotiate that. That's federal government, like my assumption. That we have to wait for the federal government to change that. So when gas goes up, it doesn't matter. We don't get reimbursed anymore. You know.
Okay.
And like I said, we're all using our own vehicles, so it just doesn't. You know, that part is frustrating.
We use the federal mileage rate that's adjusted usually about every year.
Mhm.
But that will all be discussed in the main board.
Open Yelp.
Yelp has been offloaded from this iPhone. You can reinstall it in iPhone storage settings.
Yeah, that was you.
Is he still there? Are you still there, Neil?
I'm here.
I think it was Siri.
Do you have anything to say? Yes.
I've said my piece.
Okay. Do you have anything else?
Well, and I think, Commissioner, Mason, I agree, there are a lot of entities that are faced with the same issues that we are. This is an opportunity for us to address just a small portion of that. So again, thank you guys for your consideration. We appreciate it very much.
When's the last time that you looked at all this? 2 years. 2 years ago? Was it different?
It's in the report.
Like, did people want different things or people did a 3% and I think 1 floating profit? Just one.
Yeah.
The one was to, we're not being able to ask for more than 3%, because we're still a public agency, so we would love to ask for retention staff and for 5% of COLA. Our money is still our money, and meeting the needs of what our administrative team needs, and balancing their budget. That's where we came up with the 3%, knowing that the reality is that might be the max that we're able to ask for, and so coming up with a creative solution, such as this 3%.
It was very good. It was worth it.
And just so you all know too, we had overwhelming feedback from our staff that this would make a huge difference for them, and that's morale, making them want to stay, which is ultimately going to save us all money.
That would really be a goal, just ask employees what they want.
We have surveyed them in the past and it always is a compensation time off at the top too, every time.
But nice to be up there. Well, and that was part of the reason we had to stop looking at the step increases and the longevity increases, because there wasn't more to
And full transparency, that was part of our original plan, but that just wasn't feasible for our agency, so we had every intention of asking for a step addition. But we only had so much money to work with, which is where we landed at the goal all around to make sure everybody's taken care of first, and then down the road if we're in a different situation, looking at the retention stuff, but we absolutely consider that.
Can we see anything in the future with like federal money, state money increasing or decreasing? No.
Yeah, we need that.
I need to So we're not aware.
It's like, yeah, I mean, we typically find out, you know,
After.
about a month after the fiscal year starts, you know, so.
Okay.
Scott knows.
I don't have anything else.
I don't have anything else.
If we have nothing else, I guess we can adjourn.
I'll make that motion.
Now second. We're gonna close at 6:21. Thanks everybody for showing. I thought it was great.
Thank you. Thank you.